All right, welcome everybody. I'm Carolyn Johnson, and welcome to the GACD applicant briefing for our Strengthening Health Systems funding call. So I'm guessing that because you're here, you're all experts in implementation science and chronic non-communicable diseases, and you're looking for ways to use all that expertise and find funding for your next research project. So whilst we're waiting for everyone to join, please feel free to use the chat box to introduce yourselves, say who you are and where you're joining us from. And just to run through a brief bit of housekeeping, please do try and keep yourself on mute whilst we're running through the slides, and please do pop any questions that you might have in the chat box. So today I'm just going to run through some of the specifics of our latest funding call, which is focused on implementation research, targeting strategies to strengthen health systems to tackle the growing burden of NCDs. So I'll just run through the plan for the session. Please do remember to pop any burning questions you might have in the chat, and we'll try and answer as many as possible at the end of the session. Anything we can't answer straight away, we'll try and add to our FAQ document, and we'll pop that up onto the funding call webpage. So for this briefing, I'm just going to run through a bit of background about GACD first, and then I'll give an overview of the call and how it will run. I'll take you through how to apply and guide you to some resources before we move to the Q&A session at the end. So GACD is an alliance of 11 international funders. We act as a hub, bringing funding agencies together to tackle the growing burden of NCDs using implementation research. As you can see, most of our funders are state agencies from across the globe with high, middle and low income countries represented. And if you're interested, you can actually find out a little bit more about this on our website. So I just mentioned that funders come together to reduce the burden of chronic non-communicable diseases in low and middle income countries and in underserved populations in high-income countries. The GACD model is quite different to other funding organisations, so we do much more than just fund research. We also have a really amazing research network model, which we use to facilitate collaborations and partnerships and support networking. And we also run lots of training events to support capacity building in implementation science. So just to give you a bit of an idea about what GACD has done in the past, the Alliance was set up in 2009 and in 2011 ran their first funding call, focused on implementation research around strategies to prevent or manage hypertension. This was followed by a series of disease-focused calls until 2021, when we launched our Life Course call, which encouraged a more holistic approach, addressing NCD risk factors across key life stages. We then ran our NCD Prevention in Cities call, and then last year we ran the Management Multiple Long-Term Conditions call, which we're in the process of awarding at the moment. And this latest call is focused on implementation research targeting strategies to strengthen health systems to tackle NCDs. And just in case it's of interest, you can find out a little bit more about our funded projects on our website. So we'll pop the link to that in our chat shortly. So how does this all come together? All the project teams funded through GACD, whether this is through our joint process, the EC Horizon call, or the US National Institutes of Health call, are invited to join the research network as part of a research program. So teams awarded through our Cities call are invited to join as part of the Healthy Cities research program, for example. Then the network connects principal investigators, research teams, collaborators, implementers, and even funding agency staff, and creates a really powerful space for knowledge sharing and collaboration. We run, as I mentioned, our training and networking events, and these are both virtual in person throughout the year. And this is really an amazing opportunity for people to work with a wider group, studying similar topics and sharing learning. And as a part of our network, everyone has the chance to join our workshops and our annual scientific meetings. And network members can also apply to join our implementation science schools and masterclasses. So that's it for the background information. So let's move on to some of the finer details of this call. We'll focus on our funding model, who's taking part, and how to find different bits of information about the different versions of the call, and a bit about the remit. So I'll just quickly describe our funding model. The funders that are part of our alliance come together to develop a common call text with the help of some experts in the field. We agree all the finer details, including which funders will be taking part, and this is key because funders in our alliance can not only choose whether or not to take part in a particular funding call, they can also choose if they want to run it using their own independent process or take part in a joint process run centrally through GACD. Whether or not they take part in the joint process, once applications have been received and reviewed, individual funders will coordinate their own awards. There's no common funding pot, and funding is awarded through funders' own national or state systems. So while for this briefing, I'll mostly be concentrating on the joint application process, it's important to first mention the parallel calls. So GACD funding calls usually run through 3 parallel routes: our joint process, the EU Horizon call, and the US National Institutes of Health call. For the systems call, the EC Horizon version is currently up on the Funding and Tenders portal, and they'll be holding an info day about the health cluster tomorrow on the 22nd of May. So if you have any questions about the Horizon process, this is absolutely the place to go. Just to kind of back this up, the US National Institute of Health intend to participate in this call. But as you can imagine, things are quite uncertain with the NIH at the moment, so it's worth keeping an eye on their site for any updates. Finally, 5 funders are participating in the joint call. These are the Australian NHMRC, the South African SAMRC, the Indian ICMR, Thailand's HSRI, and then FAPESP from Sao Paulo in Brazil. Focusing in on the funders in the joint process, several of our funders require applications for joint funding. So SAMRC requires applicants to request joint funding with a lead PI from NHMRC in Australia. HSRI and ICMR require applications to request joint funding, but this can be from any other funder in the call. NHMRC and FAPESP encourage co-funding applications, but will also fund applications straight to those institutions. Submitting an application for joint funding is pretty simple. One application is submitted through the joint portal, and that will go to all relevant funders. But you must ensure that the application meets the eligibility requirements of all of the funders, not just the lead funder. So some key information. Our current call is focused on implementation research for interventions to strengthen health systems to tackle NCDs. As always with GACD, we're looking for research to be carried out in low or middle income countries or in underserved populations experiencing health disparities in high income countries, including some Indigenous populations. Also, it's really important to remember that GACD focus on implementation research proposals. So we're really looking for projects studying implementation of evidence-based policies or interventions. Key for all GACD projects is also a good consortium. So you need to ensure that teams are demonstrating they have equity, the right expertise on board, and achieve a real geographical and community balance. So we know who can apply, and we know some of the key issues to think about. What are we hoping for as outcomes from this funding call? We're hoping that proposals funded through this call can expand availability of care for patients with NCDs, promote equitable health outcomes, promote the early prevention, risk reduction, timely diagnosis of NCDs, decrease the fragmentation of care. We hope that our applications will adopt a patient-centered approach, and we want them to ensure that they're catering for implementation research capacity building. And of course, we're hoping that these proposals aim to improve the quality of life across the life course and extend healthy life expectancy. And finally, we hope the proposals will provide evidence and recommendations to national programs and policies. So now I'm going to focus in really closely on the joint process, which is the version of the call coordinated by GACD. So the joint call is open now, and the deadline for our stage 1 applications is June 16th. Make sure you check the time, because our calls close at 5 p.m. UK time, which is 6 p.m. in Europe. So please don't wait until the last minute to submit, because we do occasionally get emails from people who've just gone, oh, it's fine, it's 5 p.m. in my time zone, and it's not. Just remember, we'll be running our peer review from June through early August, and then we'll send back out feedback and invite people who've submitted a competitive application to submit a second stage proposal in early September. The deadline for the second stage proposals will be the 22nd of October, and we'll be running our peer review meeting in December. It often takes a bit of time for agencies to work out what they can and cannot fund, so we anticipate outcomes will be around March 2026 at the earliest. So now I'm going to delve a little into how to apply to this call, and this is for the joint call. So I'll tell you a bit about where to look for information, a bit about who can apply, and then some information about our new application portal. So where can you find application information to help support you with your application? Please don't worry, we will put all of these links in the chat and we'll put the slides online, so don't panic that this is just going to disappear after I've stopped speaking. So you can take a look at the GACD webpage. This has information about all 3 planned versions of the call. There's also a specific page with all the information about the joint call process and a link to the portal. For the parallel calls, you should take a look at the Fogarty webpage for information about the NIH planned call. And then, as mentioned, the funding and tenders portal for information about the Horizon call. And as I mentioned, please do watch the Horizon Day info webinar tomorrow. Finally, we do also have an amazing comms manager, so it's worth following us on social media, as all the information will also go up there. So I thought it would be helpful to just go over the application format for the joint process. GACD run a 2-stage application system. So we peer review all stage 1 applications, provide feedback to all applicants, and invite those applications that show potential to submit a stage 2 proposal. This should mean that applicants don't need to wait 12 months to find out they haven't been awarded funding at the first stage, and should also allow those applicants who have been invited to stage 2 to make changes to their proposal in response to the peer review feedback before the final review meeting happens. Applicants to stage 2 will then also receive feedback and outcomes following the panel meeting. It's really important to remember that stage 1 proposals are shorter, and it's much harder to show every detail. So remember to really think about how best to get your message across in a small space. So who can apply and what are we looking for from our project teams? The principal applicants or investigators must be researchers, and they must meet the eligibility criteria of the funding agency to which they will be applying, or agencies. So typically, most of the agencies taking part in the joint call will require a PI to be from a specific geographical location. For example, the NHMRC requires the lead investigator to be based in Australia. So if you aren't sure, please do check with the funder that you're applying to, and they'll be able to tell you if you're able to apply. The application isn't just about the principal investigator, though. It's critical that the right team and the right expertise are involved. And this means including expertise in implementation research, but also remembering to keep the team multidisciplinary. When we think about the structure of the team, we want to ensure there's a balance of genders, ethnicities, social backgrounds, geography, and career stages. It's really important to ensure there's adequate representation from the country where the research will take place as well, or the community where the research will take place. And finally, projects should reflect clear early engagement with stakeholders, including community members or patients, health providers, NGO and implementation leaders, local ministry officials, and national policymakers. For this call, the proposal format is slightly different to the last time, so make sure you take a good look at the webpage, check out the guidance, and download all of the templates. And these are just some of the things to think about when you're writing your proposal. We want reading the applications to be easy, so really think about the reviewer when you're writing. Make it clear and easy to follow, and stay within the word and page limits. We don't want to have an application rejected just because it hasn't followed the guidance. Make sure that any ethical or security issues are clearly addressed, and think carefully about outcomes. Lots of projects won't have health outcomes in 3 to 5 years, so the outcomes that you're actually stating need to match the timescale. And really don't forget to include your implementation outcomes too. So now a bit about how to apply to the joint process. So you'll notice this year we've switched to a new application portal, which is run on Airtable. So just beware, you cannot save your application in process. So please do leave yourself plenty of time to input all the information and make sure that you have all your uploads ready when you're submitting. PIs can only submit one application to the call across all participating GACD funding agencies in the joint call. But you can be a PI on one application and a co-I on multiple others, or you can be a co-investigator on several different applications. You may be required to submit your application through the funding agency website as well. For PESH, are requesting that all applications to them go into their SAGE system. Just beware, the call isn't quite active yet, so hopefully that will come up in the next few days. Do also remember the application must be submitted in English. There is some guidance around translation on our website, but I'd always recommend getting a native speaker to read the proposal if you're worried. So this is what the portal looks like for the joint call. Make sure you keep an eye on the tabs on the sides. It won't let you complete your submission unless you've completed all the necessary steps. And of course, any problems, just send me an email. So you should be able to do things like select the relevant funding agencies and add all of your project details and abstracts. And again, I recommend just actually having these out in draft before you start your application, because it'll be much easier to just copy and paste things in. And of course, you can upload all your relevant files, and it's literally a drag and drop system, so not a problem. You'll also have a chance to give a brief description of any ethical issues. And finally, to make sure that everything's correct and you've uploaded all of the relevant information, including additional uploads such as things like an M-ERA form for any digital interventions, and the your Indigenous Research Excellence criteria, which is required for applications to NH and MRC involving Indigenous communities. And now I'm just going to hand over to my lovely NH and MRC colleagues to run through the Indigenous Research Excellence criteria.
Thank you, Caroline, and it's great to be here today. I guess the next few slides relate to GACD research projects based in Australia. So research that relates to the health of Aboriginal and Torres Strait Islander people in Australia is eligible for funding under this GACD call. And the Australian National Health and Medical Research Council has requirements and processes that are designed to ensure that the research into Aboriginal and Torres Strait Islander health is of the highest scientific merit and is beneficial and acceptable to those populations. Next slide. There are links to resources for applicants in the guidelines, so I refer you to those, and that will help you in terms of considering the criteria for research in these populations. Next slide. So NH and MRC has specific Indigenous research excellence criteria, and GACD applicants, which include research effort and/or capacity building activities related specifically to Aboriginal and Torres Strait Islander health people's health, must address these criteria, and they include community engagement, benefit, sustainability and transferability, and building capability. Next slide. The Indigenous Health Research Excellence criteria are integrated into the GACD peer review process, and this slide just outlines that process. So in stage 1 applications, you're required to complete the Indigenous Research Excellence criteria questionnaire, which Carolyn mentioned is available on their application site. And that will be considered by peer reviewers in the initial assessment stage. Applicants who are invited to stage 2 will complete the Indigenous Research Excellence criteria responses within NH and MRC's grant management system, SAPPHIRE. And those will be evaluated by experts in Indigenous health research, and those evaluations will be provided to the peer review panel. The peer review panel will then consider the responses and the evaluation as part of their assessment of the application. There's information in the guidelines about this, further details if you have any questions. Thanks, Caroline.
Thanks so much, Pat. That's really helpful. So just to wind up this bit of the session, I want to take a minute to digest some of the information before we head into looking at some of the resources that are really there to help you with your application. So it is really worth downloading all the templates and taking a quick preliminary look at the portal before starting your application. Make sure you have all your supporting documents ready and try and think like a reviewer. What would you want to see, or what do you think could be better expressed? I know everyone works differently, but really do remember to take the time to organise your thoughts and your documents before you apply. So I'm just going to finish up my presentation by signposting some useful links developed by our amazing staff team and fantastic researchers. So with the help of our funders, we've developed a series of resources to help you craft your application and also to guide you around some of the trickier aspects of GACD proposals. So these include our general proposal guidance, our evaluation criteria, and some top tips for writing proposals and responding to peer review comments. And finally, there are also some really useful links on Horizon Europe and NIH applications. So next up, we have our amazing Implementation Science eHub, which is a fantastic resource to help you learn more about implementation science. It's fully open access and self-paced, and this is a great place to start your implementation science journey. It's also got some real-life examples of implementation science of tackling NCDs, and there's a resource hub which has some extra external tools and guidance. The eHub also has some amazing, brilliant collections of resources, and I can highly recommend taking a look at the stakeholder engagement collection on there. It's got a good introduction to stakeholder engagement, some expert-led videos and downloadable materials, and some key resources and frameworks and top tips on there, as well as some really useful case studies. So we've probably reached the point that everyone's actually been waiting for, which is a chance for everyone to ask questions. I will try and run through the chat in order, but if I don't get around to your question, please don't worry. We'll put together an updated FAQ document and we will add that to the webpage. I just wanted to leave you with these key considerations before we jump into those questions, and thank you all for actually listening to me for all this time, and to thank the amazing funders who are going to help me to answer all these questions. So I'm going to stop sharing, and hopefully now we can start jumping through some scary questions, which I can see are already leaping up on the screen. So, how do you register for the Horizon Europe Info Day? It doesn't say so. It doesn't say this on the Funding and Tenders portal. There's actually a completely different website for the Horizon Europe Health Info Days, and we can pop the link to that in the chat. There is an editable document that can be incorporated into the proposal document. When you look into the call webpage, you'll actually see that you can download templates for your application as well as your proposal guidance. And the template for the application is a Word document, so you should be able to just go through that and edit and apply. There are not necessarily budget limits. There are different budget limits for different funders. There is a budget template within the proposal form, and that does tell you what can be allocated to where, but realistically, you have to think about your budget, what you need, and what's appropriate for your project. So it really is about understanding if you need, how much travel you might need, how much money you might need for consumables, what staffing you need. So it's really is critical that you think about your budget. It's not critical to focus on one main NCD. This is a call about strengthening health systems. So we're also focused on prevention, risk factors. You can study multiple NCDs, and it also doesn't have to be one of the big 5 NCDs. With GACD, we work on all NCDs. We're not just focused on the big ones like hypertension and diabetes. So there's no I agree, there's no single gold standard when implementing an intervention at the system level. It's interesting, the evidence-based question comes up every single time we have one of these calls or webinars. And I think probably, sorry, what you have to think about is what evidence would suit you. If you're a reviewer, what evidence would you need to see to convince you that that intervention is going to work and going to function? And that evidence could be a case study, it could be loads of peer-reviewed papers, it could be WHO information, it can be anything that you think is really going to make people believe that this intervention is going to work. And it doesn't have to be direct RCT evidence, as I just said. We will be sharing the slides and the videos later. Yes, so I've also had another question kind of around the proposal budget template. You can add extra lines or extra partners into the proposal budget. NH&MRC, so we had a question around whether NH&MRC would only fund Indigenous research for this GACD round. I'm sure Pat will agree with me in saying that no, they will fund research in low and middle income countries or in Indigenous populations in Australia. Is that correct, Pat?
Excellent. Yes, that's correct. Yes.
Perfect.
And we do encourage funding, joint funding with other GACD associate members as well. So we're open to joint funded proposals as well.
Excellent. Do you have to use the budget template provided on page 9? Yes, unfortunately, you do have to use the budget template provided on page 9. You can add extra lines to it, you can add extra columns, but you do have to use it. And it should be editable because although you're looking at the application guide, so there's application guidance, which is PDF. There is also an application template, which is a Word document, which is fully editable. And yes, again, we've had another question around 1NCD or prevention. So that's it. Sorry, I'm just running through this chat very slowly. Are US research institutions focused on mental health in Kenya appropriate for the call, and what would the budget limits be? So if you're a US research institution, you would have to be just watching and waiting for the NIH call, unfortunately. And again, I think all of that information will come up on the NIH website if they do manage to participate in the call. So, we've got another nice NIH and MRC question saying, regarding NIH and MRC funding, we understand that they can fund projects with international partners that meet one of the strategic objectives of the NIH and MRC plan, international collaboration and exchange with a specific list of countries. Can you confirm that this can be funded and that NIH and MRC would then fund the relevant country partners as well as the Australian research team? We were advised that NIH and MRC will only fund the Australian uni team. Pat, again, is going to agree with me here because no, they will, NIH and MRC will fund teams in lower and middle income countries as well. There are some specific rules around that, aren't there, Pat?
Yes, that's right. The lead chief investigator on the Australian component of the application has to be residing in Australia 80% of the time, and the NIH and MRC funding from us goes to an administering institution in Australia. However, components of the project can be funded in low-income, middle-income countries, and staff can be funded as well as components of the research can be funded in those countries. We also can have joint funding with other funding agencies in other countries, in which case that other funding agency might fund their component of the project and be led by a researcher in that country, in addition to the component funded by NIH and MRC with the Australian lead investigator. So I refer you to the guidelines because there's specific eligibility criteria around that as well.
Thank you, Pat. Super helpful. The next question, is the EU joint application requiring application to just the GACD site as well as the EU site? No. So as I said earlier, the Horizon system is completely separate from the GACD joint application system. So Horizon, you just have to apply through the EU funding and tenders portal, and they will run, accept the applications, run the peer review, do all the checks and do all the awarding themselves. It's completely independent. So you don't have to do anything on the GACD site if you're applying to Horizon. If you're applying for a non-joint call to NIH and MRC, do you still need the stage 1 form? The only way to apply for this funding call to NIH and MRC is through the joint system. And so you would have to fill in the stage 1 application form. That doesn't mean you're applying for joint funding. You're just applying straight for funding from NIH and MRC, but you still have to go through our system for the stage 1. I hope that makes sense. Should all the proposals go through the joint call? If so, all the funders have different criteria. The funders do have slightly different criteria. So if you're applying for joint funding, then you do need to consider and make sure that your application is eligible for funding from both funders and make sure you're requesting the right things from each funder. But if you're applying through to a single funder through the joint call, you should be able to meet those requirements. When is the project start date? The project start is we usually expect that to be within about 6 months of the award date for is what I would have said, but I'm not sure what NH and MRC say. So I might ask Pat about that, but usually the project start date should be early 2026. Is that about what's NH and MRC's start dates, Pat? Sorry.
I might defer to Melanie for that if she's online, the actual start date.
Hi, Pat. Yes, the start date will depend on when we can announce the funding from NHMRC for that call. So it's quite open, but as Carolyn mentioned, it would be anticipated March 2026, maybe when outcomes are released, so early 2026. Thanks.
Melanie, you're a star. Next one, what's the project period? So it's 3 to 5 years normally, but I think it can be less. I think it would be, I would say personally, I think it would be difficult to deliver a project in less than 3 years because these tend to be quite complex, but it is possible. And again, that depends on the funder. There is no budget cap per se, but each of the funders have a committed budget to the call and an expected number of projects that they're going to fund. So what you need to do is take a look and work out what's a sensible budget for your application. And just for let's put an example, if a funder is committed $1.5 million and is expecting to fund 3 projects, they're not expecting you to come in asking for $1.5 million. Does that make sense? I hope that makes sense. They will be expecting people to be looking and working out what's a sensible budget. So I'm South African, but live and work in Australia. I want to apply to do a project in South Africa, not in Australia. Can I apply to NH and MRC to do so? Yes, you can. If so, does the funding envelope stipulated by SAMRC apply to the project overall, or can we budget for more with co-funding from the SAMRC and NHMRC? You can budget for more if you're working in Australia and then you're going to be conducting an implementation research project in South Africa. You can apply for money from Australia plus the money from the South African SAMRC. Hopefully that makes sense. Any advice on the budget section of the application? Be sensible, apply for the funding that you need. Don't apply for more funding than you need, because people are always looking for it to be good balance of costs. But also remember that it's if you try and ask for too little funding, then when people are reviewing it, it's not going to look feasible, and they will say this isn't feasible, they haven't asked for enough money. So ask for the funding that you need. What are the criteria for being a PI? It does actually depend across funders again, but you're expected to be a researcher with enough experience to run a complex project with potentially a multi-country team and consortium behind you. We have had relatively early career researchers awarded as PIs before. Again, they've demonstrated in their track record that they've got that experience, expertise, capacity to run such a team. The joint call application is so there isn't a separate call to NH and MRC or any of the funders joining in this joint process. The call is this joint process for NH and MRC, SAMRC, HSRI, ICMR, and for PESHB is run centrally through GACD. So there isn't a separate call, and there is no. You wouldn't be applying to NH and MRC through the Sapphire system at this stage 1. Everything goes through our system through that single application form. As a potential applicant from South Africa, is there any advice on linking to a potential collaborator in Australia for the joint SAMRC and NH and MRC application? First of all, I would say think about your networks, people you know, people that you've worked with, reach out to them. We do have a Find a Collaborator system on our website. I'm not convinced there are lots of people from Australia on there at the moment, but you could also try that. If you're from Pakistan, can you apply for work with Indigenous populations in Pakistan through NH&MRC? Yes, absolutely, as long as you had a principal investigator, so the CIA, based in Australia. What's categorized as a lower middle income country? I would suggest you look at the World Bank definitions. That's what we use to define lower middle income countries, and we've linked to that both in the call text and on the website, so you should be able to find those links quite straightforwardly. And I do believe that Indonesia is a middle income country, she says, hopefully, but we've definitely had projects in Indonesia before. As an organisation working in LMIC, based in LMIC, which funders should you be applying to? It really, again, it depends where you're from. So if you were applying through the joint call and you're in LMIC that was not one of the funders on the call, then you would need to find a collaborator from one who is eligible to apply to one of the funders in the joint call. Otherwise, you could also reach out to people who are eligible to apply to the EU Horizon call and go through that system. Or you could try keeping an eye out for the US NIH version of the call. Although, again, I'm not sure what the terms and conditions will be like now, because previously people from LMICs could apply as the principal investigator. But again, we really don't know. It's completely uncertain at the moment. For proposals from Spain, including countries in Latin America, you must go to the EU participant portal. Absolutely, yes. If you're coming from Spain, you would need to go through the Horizon version of the call. If you're applying to Australia but working with Indigenous populations in another country, are you required to complete the IREC form? So the IREC form, as far as I know, and I can probably call on Pat and Melanie again, is only for research with Indigenous populations in Australia. However, I think it would be really good. Yes, Pat said that, but it would be really, really good in future if we managed to do this for other Indigenous populations, because it's an excellent system. For NH&MRC, is the fund. The fund is not only for Indigenous populations in Australia, it's also open for projects in LMICs, as we've said. So it's a nice one. Does the research proposal have to be strictly implementation science, or can it be complementary to implementation science? No, unfortunately, it really does have to be focused on implementation science. There are obviously complementary things that might filter into your project, but realistically, the main focus has to be implementation research on evidence-based intervention. Which body would fund research based in Kenya or Africa? Again, if you were going for research in Kenya or Africa, you might be thinking about working with a team in Australia or India or Thailand or Brazil. Otherwise, again, you could think about going through the Horizon call, or you could think about the US NIH call. If you're from South Africa, the joint application process with SAMRC and NH&MRC is mandatory. Yes, you have, if you're applying from South Africa and you want to apply to SAMRC, you do need to apply for joint funding with NH&MRC. Oh, for the NH&MRC budget, someone says, assume we use PSP rates. Pat, what's a PSP rate? I don't know.
That's a personal support package rate, and yes, there's details about that in the application form details. So yes, it's the standard NH&MRC direct research costs and PSP rates that we use in Australia.
Fabulous, thank you, Pat, because I had no idea. So in the budget form, can a partner be an individual person from an organisation, or does it have to be an institution itself? No, if you're just working with a single person in an organisation, you can put them down as one of your partners. That's absolutely acceptable. Is there guidance during the application process? As Izzy has so kindly said, there is lots of guidance on our website. And if you do have questions when you're running through it, do feel free to just email us. We are here to help. We're here to answer your questions all the way through. Thanks, Morgan, as well. So for the joint funding of 2 countries, the project must be successfully granted by both funders, or can it be granted by only one funder? No, it would. So that is always the trick with joint funding. So the application will only be assessed once. So you won't get a different score for different funders. There would just be one score. So it really depends on where it comes on the ranked list for each of those funders. So you would have to score highly for both funders. You would have to score highly, and then both funders would have to have enough budget for your highly scoring application to be funded through both of them. So let's say you're ranked first for HSRI and 6th for NH and MRC, you might be unlikely to get the funding because it might be outside of the budget line for NH and MRC. But if you're ranked 2nd for HSRI and 2nd for NH and MRC, that might be much more likely to be funded. I hope that kind of works as an explanation. As a potential applicant for India, I'm engaged in mental health research with a focus on implementation science and integration into primary care. Okay, yeah, and that's looking for partners. Can Indian partners apply for the EU call along with other partners? That's a question for the Horizon webinar, definitely, because the India question always comes up, and I seem to remember it's quite complex because India partner on some Horizon calls, but not on some specific Horizon calls, but not all of them. But if you were applying to the joint call, you could apply to ICMR and then potentially one of the other funders in the call, not SAMRC. But not with the UK, obviously not with the UK partner as the other lead, because there are no UK funders in the joint call. When applying from Australia for work aimed to address NCDs in India, would you recommend applying through NHMRC or the Indian agency? I would recommend applying through both. That would be my sensible answer to that, because not only can you maximize the budget that you're applying for, but it really gives the partners in India agency to have their own money and the partners in Australia agency to have their own version of the funding. So it's a kind of win-win to apply for joint funding in that system. Would you consider autism or other neurodevelopmental disorders in children as appropriate NCDs? Actually, yes, we had this question come up last time. It does depend a bit on what you're looking at as neurodevelopmental disorders, but things like, but there are definitely issues in there that can be covered. So yes, they are NCDs technically. So someone from the UK, how would you apply for funding to work in several South Asian countries? I presume that it covers some of the countries, but India seems to be different. So again, yeah, this would be for the Horizon call, and I would recommend going to join their webinar tomorrow and finding out, because India, as you note, is different. They're not always partners on the Horizon calls. They only partner for specific ones. So it's quite difficult to work that out without asking them directly. Can the applications have a multiple PI system where one PI is Australian and another in the LMIC? Yes, you can, because obviously there are 10 CIs in NHMRC applications. You would have, if you're applying through NHMRC CIA, so the number 1 would have to be based in Australia, but then you would be, if you're doing work in LMIC, I would be expecting to see CIB as someone based in the LMIC. I hope that makes sense. Can Indian partners apply to the Horizon call? I don't know. Please do go to the webinar for that. It is really, really useful. We had a lot of questions about India going through Horizon last year. So please do go and check, watch the Horizon webinar. It's always different. It really does change from year to year. Oh, are Australian temporary residents eligible to be a PI if applying through NHMRC? Pat and Melanie, this one's definitely for you.
At the time of acceptance of the grant, the Chief Investigator A must be an Australian or New Zealand citizen or a permanent resident of Australia, or have an appropriate work visa in place. The other Chief Investigators, what's the question again?
So it was
doesn't matter.
So, yeah.
So it's just the regulations for the Chief Investigator A.
Great. That's perfect. Thank you, Pat. Do researchers in Kenya qualify to apply directly for EU funding, or do they need an EU country partner? Again, I think you do need to double check on the Horizon website, but what I would say is the projects I've seen going through there usually have a Horizon associated country as a partner. So still confused for joint SAMRC and NHMRC funding, the SA part would have to be funded by SAMRC and can be topped up by NHMRC funding. Yes, absolutely, that's right. So you would get the 70,000 Australian dollars a year from SAMRC, but you can get more money for the South African investigators from NHMRC. I hope that makes sense, but if it really doesn't make sense, send me an email and I will reply. There's mention that there may be extra funding for Indigenous projects in Australia. How does that work? Pat, I think this is under the strategic side.
Yes, I guess for all NHMRC funding schemes, there is what we call structural priorities. And one of our enduring priorities is research, health and medical research focused on Aboriginal and Torres Strait Islander peoples and communities. And so this funding can be awarded in addition to the $5 million that is specified for this grant opportunity.
Thank you, Pat. So the next one says, are there going to be agency-specific meetings for this as well? So I would say, no, there won't. In most cases, there may be one for PESHB, but we haven't sorted that out yet. But if you do have extra queries for your funding agency, then check the agency-specific information, because there is actually an email contact in that form, and you can send them a message directly to ask specific questions of the funders. Applications for a post-conflict setting like Syria, would these be considered given the uncertainty in the political situation? What funders would you recommend for our setting? So first of all, if you're based at LSHTM, then I would recommend going through the Horizon system. Secondly, I think it's a very interesting question. We've had issues like this in the past with applications, and I would highly recommend that you really think and plan and make sure you've got good mitigation plans in place, just in case you can't actually roll out what you're planning to roll out due to changes in the political situation. I don't think there's a reason not to apply, but again, think carefully, plan carefully. For the NHMRC call, does the consortium lead need to come from Australia, or can the lead come from a non-LMIC country? No, Pat's going to agree with me here that lead for NHMRC, CIA has to be Australian, or from Australia, or a New Zealand citizen, and they have to be resident in Australia, a permanent resident in Australia. So the LMIC partners, we would expect to be CIB going onwards. The recording, we will put recordings of the meeting. We'll put a recording of this version of the meeting up online after, probably by the end of the week, hopefully. There's no specific budget template for any of the funders at stage 1. There will likely be funder-specific budgets at stage 2. At stage 1, we're really looking for a broad view of the budget. It can change between stage 1 and stage 2 a little bit in response to the peer review, but really we're not, at the moment, we've not got specific funder budgets, because we want to make this an easy, simple system for our peer reviewers to be able to look across applications and say, that's what these people are asking for, that's what these people are asking for, and it's all easy and comparable. So the ICMR budget form would come in at stage 2, most likely. What's the relationship between the Horizon Europe call and the GACD call in the context of involving an Australian partner? Oh, yes. So an Australian institution can be included in a Horizon Europe proposal as a partner without requesting EU funding. But the issue is these are parallel, as noted in this question, these are parallel calls. There isn't a connection. So if you applied to the Horizon Europe call, it would be a completely separate, different application that we would be expecting to see to the joint call. There is no connection, and it would be, I suppose, if you're expecting to try and fund the Australian partner through the joint call as part of a consortium on the Horizon Europe call, that would be very risky. So I would suggest think about them as separate projects and make sure they're independent because it's not possible to do a joint application through Horizon and our joint process. Is cost effectiveness as a main outcome considered implementation science? It could be an outcome. Again, I think you need to think about all the other implementation outcomes that might also be relevant, and the health system outcome change, or the impact on the health system outcomes as well. Which body would fund research based in Ukraine? Again, if you're doing research in Ukraine, then you could potentially, again, think about the NIH. We don't know. It would also be worth considering if you want to find a Horizon associated partner and go through the Horizon system, or find an appropriate partner in the joint call. But that depends, yeah. Can a partner organisation based in the EU join a research team led by an Australian team implementing research work in LMICs? Okay, so Pat, I believe it's true though. I've seen NHMRC do fund researchers associated with NHMRC calls in high income countries as well, as long as the focus of the project is the low income country. Is that correct?
Yes, that's correct. I guess there can be, as you previously said, there can be 10 chief investigators on an NHMRC application. The lead has to be from Australia, but any of those other chief investigators or PIs on that application could be from an EU country, or could be from the low middle income country, all joining together on that NHMRC application.
Sorry,
if that answers the question.
Sorry, I've just been joined by a wet cat that's trying to destroy my desk, and I'm just going to hang on to it for a minute. Good. Are hybrid type 1 implementation designs focused on effectiveness encouraged for this call? Hybrid type 1 is fine. I think people often assume that we're just going to focus on type 2 and type 3. It's okay. It's really what you think is going to be most appropriate. We do often see people think about what reviewers think, because they often see hybrid type 1s as quite early stage, but again, it's fine. Are there plans to include anemia as an NCD? I mean, blood disorders themselves can be NCDs. There's certainly a fair number of them that are. So, and I don't think we are going to be the people defining NCDs. That's definitely up to WHO, other organizations. Is it hybrid implementation trials are within remit? And yes, you have understood that through EU Horizon Call, you don't need to apply through the GACD portal. Are injuries considered NCDs? No, I think would be the answer. We go for chronic non-communicable diseases rather than injuries. Does testing a new intervention for secondary prevention in the public health system count as health system change? I would say that does, but I don't think testing a new intervention is implementation research, so that wouldn't be in remit for the call. Do you count prevention as interventions? Yes. Funding limits, again, are dependent on the funders. Done that, and we've got lots of nice people replying. Can the methodology include technology development as part of this call, or should it focus on established technologies? So again, we're looking for evidence-based interventions. So normally what we're expecting is for that technology to actually exist already. Can the PI be from a private organization? I think that again depends on the funders, but usually not. And usually we expect them to be from a research organization of some sort, so clinical. Is that true for NHMRC as well, Pat? Sorry, they ask, could the PI be from a private organization, so profit or non-profit?
Yes.
There you go. Can this RCT be in one specific country, or it can involve multiple countries, multiple health conditions? Again, think what reviewers will think, because if you're looking at different conditions in different countries, that might be spreading your expertise quite thinly. So do try and think like a reviewer when you're thinking about these. Do think about the focus. Right. I think we've got 4 minutes to go, and it looks like we're running almost the end. So is the UK institution still eligible within the EU Horizon Call? Yes, the UK is an associated country, so you're eligible to apply to Horizon. Can it be 3 joint funders, NHO and MRC and 2 others for one application? Yes, absolutely. Could even be 4 or 5 if you're really, really exciting. But yes, absolutely, that's not a problem. Chronic rheumatic heart disease is an NCD. And for CIs in Australia, can some of them be non-researchers, i.e. Indigenous knowledge holders? Yes. Yeah, absolutely. I think if you're working with an Indigenous community, I think we'd be highly expecting that to be the case. And yeah, realistically, I think we're nearly at the end of this. So I think we're going to call the questions a day there and say to everyone, thank you. So massive thank you to our funders for coming and answering all these really complicated questions. But also want to say huge thank you to the GACD team, because Izzy and Cherie have been working really hard in the background to try and make sure I don't miss loads of questions, and also trying to make sure everything runs smoothly. So I'd like to say a massive, massive thank you to you. And also thank you to Johan for joining us from SAMRC. Thanks, everybody. Have a lovely day, evening, night, whatever you're going on to. And if you still have loads and loads of questions and you're in a convenient time zone, there will be a second batch of this meeting later on. So you feel free to join again. But thank you so much and have a lovely rest of your day.